I tend to look at information that is amassed over a month or a quarter or a year. But that's not how staff experience it. They experience it minute to minute to minute. And so the data can say one thing and the reality can feel different. And so it's important for me to kind of stay open and ready to hear what I need to hear because of realities like that.
Welcome back to Tell Us Why, a podcast about and for the healthcare workforce. Thank you all for tuning in. I'm Jen Wright, joined by my co-host Beth Morgan. And shout out to our colleague and producer Kyle Peterson, who recently made us aware of an interesting and unique initiative within HCA Healthcare to curate connection and community between executive leadership and frontline clinicians. A key element within a broader engagement strategy, A Walk in Your World elevates the voice of the workforce through experiential listening.
So our guest today is Hugh Tappan, a division president with HCA Healthcare, and we've invited Hugh here today to share his experience with this really cool initiative they have called A Walk in Your World. He's going to tell us all about what it's like to be on the front lines with these healthcare workers and how this program fits into HCA's more comprehensive efforts to improve the workforce experience. Hugh, welcome.
Thank you. It's good to be with you.
So, Hugh, we really love to start by asking all of our guests to share their why. So, what personal and professional paths led you to your current role at HCA, and what drives your commitment to healthcare workforce?
Yeah, thanks for that question. I love starting with the why. It's one of the things that I believe this whole program is designed to help us reconnect with. The why is such a critical part of what we do and such a critical part of our messaging. And so my personal why, when I grew up, I didn't have anyone in my family that was in healthcare. My father was a salesman. My mom actually completed her undergraduate degree while I was in high school, and she started working for Blue Cross Blue Shield. So that was my first sort of exposure to healthcare, but I never really considered healthcare as a career. So I went to college. I got a degree in finance and an undergrad in English because I thought I was going to go to law school. That was the plan. I graduated college. I started talking to lawyers. I couldn't find a single happy lawyer. Everybody was unhappy with what they did. And I thought, I don't want to be that guy. I don't want to get years down the road and be frustrated by my job. I want to do something that's meaningful. I want to do something that's impactful. And so I started the process of just looking for jobs and trying to decide what was next. During that summer, when I was looking, I had the opportunity to spend a couple of days with a gentleman named Ron Baer, who was the administrator of the Riverside Clinic in Jacksonville, Florida. And the first day that I showed up, Ron, a big gregarious guy, very funny, incredibly engaging. And so I met him because my parents were friends with him, and he took me around the clinic. And as we ran into different people around the clinic, as we ran into nurses or we ran into doctors, it was amazing to me the questions that came at him and the multiple areas that any of those questions might involve. It might be about or it might be about a connection to insurance, or it might just be about a connection around the baseball game that somebody's kid played the night prior. Listening to these doctors then talk about a clinical situation with a patient, I didn't understand anything they were talking about. I didn't understand a single word of it. And I thought, I can't be that. I'm not at a point in my life that I could go back to medical school or do anything of that nature. But I could do what Ron does. And that's exciting. So I asked Ron, hey, can I come back tomorrow? Do you mind if I just spend another day with you? And the more that I followed Ron across those 2 days and the more people that he connected with, the depth of conversation with certain people and frankly, the just myriad of things that he dealt with in a day, I fell in love with. And so I started trying to figure out, how would I do that? How would I get into that kind of job? Luckily, University of North Florida had a new MHA program. And so I pursued both an MBA and an MHA. Quite frankly, I got the MBA as a fallback in case this hospital
Sure.
thing didn't end up out. And I just figured I needed to have that backup. And so I got that, and I had the opportunity to actually do an internship with Blue Cross Blue Shield of Florida, and I didn't enjoy it. I didn't love the work because it was all in an office and removed from real people, but we
Mhm.
used lots of care language, and it just it didn't feel like me. And so I had that experience. I was happy to have that experience, allowed me to graduate. So that was a good thing. But then I pursued an administrative residency. And as I was looking for administrative residency and I looked all across the country, I had an offer to go to Columbus, Georgia and do that administrative residency at Houston Sports Medicine Hospital. And it was an HCA hospital. I didn't know time. I knew that a person, Charlie Keaton, brought me up for an interview and he hired me. And this was back during the day when you didn't necessarily focus on Joint Commission surveys until you got to the year of a survey. And he brought me on and he said, I need you to make sure that we're ready for Joint Commission. You know what that is, right? And I said, yeah, we talked about it, but I have a lot to learn. And he said, yeah, we'll figure it out. And so that's how I got hired. And I spent a year doing that. I then had the opportunity to stay at Houston in an HR role. He moved me into director of this small hospital HR department. So we have about 100 beds, orthopedic specialty hospital. And I ended up spending 10 years at that hospital. And so I was an administrative resident, and then I was in HR, and then I became essentially the COO. It was a different title, but that was the role. And then at the 5-year mark, I felt like it was time for me to look for other opportunities. I met with the person that was the division president at that point in time. His name was Frank DeMarco. Frank lived in Charleston. And so I came to Charleston actually for Spoleto. And while I was here, I asked Frank if I could sit down and talk to him, shared with him where I was, shared with him how long I'd been there and what I was interested in doing. And frankly, he offered me the opportunity to stay in that hospital and become the chief executive officer. Very non-traditional path through those first couple of jobs. But I accepted the role, and then I became the chief executive officer of that hospital. I was there, again, a total of 10 years. And then I was looking for other opportunities at larger hospitals. Provided an opportunity for me to move to Denver, Colorado, where I became the chief operating officer of Presbyterian St. Luke's, large 680-bed hospital. I was there for 2.5 years. That provided me an opportunity to interview in Wichita, Kansas. I became the CEO of Wesley Medical Center. And then after 9 years at Wesley, that presented an opportunity for me to become the division president for HCA Healthcare back in Charleston, South Carolina. And so it was great for my family to be able to come back to the South, back near family.
Yeah.
And an absolutely wonderful career path, all within HCA. So I've now been in the company for 31 years.
Wow.
And my original why of just this fascination with what this one person, Ron Baer, did
Hmm.
over the next couple of years cemented as my grandfather was going through lots of care issues, ultimately leading to him to have time in hospice. And so it really brought home for me kind of the need for us to focus on the continuum of care and how do we think about our patients throughout that process. My time at Houston allowed me to focus really on specialty care and how are we focused on our, not just patients, but the visitors that come with patients, the family members and their perception of healthcare. And it
Mhm.
allowed me to think about and work on care differently. When I got to that big hospital in Denver, it allowed me to start working on graduate medical education and thinking about how we pull new people into healthcare from a physician standpoint. I've been thinking about that from a nursing standpoint for a while, but this kind of really changed my thinking. It also, because that hospital was focused on bone marrow transplants and focused on really subspecialized neonatal intensive care programming, it caused me to think about outreach programs and kind of that hub and spoke idea of hospitals. And it brought
Mhm.
me to a different level of connectedness from that standpoint. When I got to Wichita, we had a really large graduate medical education program. And so that allowed me to focus on that. And that hospital, as a level one adult trauma, level two pediatric trauma provider, and a really large community care provider for that community, just brought a different focus for me in that role.
Mhm.
And so now in this division role, I'm able to think about our small hospitals, our large hospitals, community-based programs, subspecialty programs. And it allows me a connection point because of all of that time to just think about that portfolio of hospitals that we have today in the South Atlantic Division. And I'm thrilled and pleased, I guess, that I've had that why, that this is just a lot of fun and critically important. Right? Let's not miss that.
Sure, sure.
And so the work that we do is just so important every day. And I love that I can bring that experience from all of those different geographies and all those different types of hospitals into my current role.
Love that you said, like, basically all those things that you've gone through, all those experiences have sort of built you to the point you're at now. And I love that
Mhm.
you use the word fun. I don't know that I hear that a lot from executives, so it's very refreshing. So we're here to talk
Absolutely.
about the awesome program that you guys have called A Walk in Your World, which really elevates and kind of ties into that broader strategy of elevating the voice of the workforce. So do you mind walking us through that? How does that program work?
Yeah, happy to. It's actually pretty simple. So administrators throughout time have gone through the process of rounding and making sure that they are available to staff, available to physicians. Obviously, we've got lots of different types of rounding that we do, right? Whether it's environmental rounds or it's employee-based rounds or we're doing patient rounds. There are lots of different types of rounds. The walk in your world is designed to be a job shadowing experience where we take a half day and we really plug into the experience of a caregiver. And we're with that caregiver to try and understand the nuance of their work and how everything impacts them. And so I've had the opportunity to do this in multiple hospitals across the division. But the core of the idea is, as a corporation, when we were focused on developing a nursing strategy that said across the company, we need to elevate the function of nursing. And we need to make sure that nurses understand how critical they are to our overall function. And quite frankly, executives from a hospital level, division level, corporate level, we need to stay connected to that work. The core of Walk in Your World began with the nursing strategy of HCA, and how do we make sure that we bring all of our division executives, again corporate executives, into a shadowing experience so we don't get disconnected from the bedside. And this is one way that allows us to really hone in. And again, focus on a person and focus on that experience for a significant block of time.
I love that. And I love
Love it.
the kind of it feels a little full circle because of your description of those opportunities for you to walk alongside folks that may have ended up being your mentors early on in your career path. And now, it's you get to walk alongside frontline providers.
Yeah, that's exactly right. And back to fun. Quite frankly, this is fun. It is great fun to understand what someone else does on a daily basis and their why and what is it that really, kind of fills your cup in terms of the work that you do. And by the way, let's talk about those things that don't fill your cup in your normal day as well,
Exactly.
because if there's something
Yes.
that we can do to fix that, to help that, then let's do it. Let's try and work on that. And so there are lots of things that we're able to gain from this whole experience.
Definitely. I love that kind of rehumanization, right? That really deep human connection over just a task of a work day. So another essential element of why is protection from harm, which includes ensuring a manageable workload. So when you step into a unit, you're seeing the reality of the environment versus just kind of storytelling and theory. So, what was your mindset going into your most recent walk? And how does that experience maybe differ from the concept of traditional executive rounding or town hall style connection points?
Yeah, so I guess let me do those in reverse. So
Okay.
town hall connection is really largely a push communication style, right? It is we're going to develop an agenda and we're going to take however many minutes of our agenda and we're going to make sure that we're pushing information out to the workforce in a broad setting. And we're going to try to make sure that our why around whatever that big issue is. And so we're going to talk about, if I just stay with your safety idea, we're going to talk about what we're doing legislatively to try and ensure safety of healthcare workers. And we're going to communicate what we did in the 2024 and 25 and 26 legislative sessions to try and push this idea. So we're going to communicate that out to the broad audience. Now, we're going to generally take questions during that town hall setting, but it's not intimate. It's very much a broad communication format. Okay. Traditional hospital executive rounding and what we gain out of that. When I used to go out as a hospital executive, I would tend to have a particular purpose. So today, as I'm rounding, I'm going to round on 5 or 6 different units. I'm going to do that across whatever, 30 or 60 minutes. And in those 30 or 60 minutes, I'm going to try and review stoplight reports on every one of the units. I'm going to do a little bit of environment of care rounding as I'm out and about. I am going to look for safety issues, right? I am going to be concerned and I'm going to ask our staff about safety issues that are potentially happening around the unit. But it's not a deep dive. It doesn't get into the core of the work or the relationships. And the walk in your world is designed to force us to pause and not keep moving quickly and not have a single point of effort. And so my last experience was in the emergency department at our hospital in Savannah, Georgia at Memorial Health. And I had the opportunity with a midday shift to follow one of our clinical nurse coordinators across the industry. That role would normally be called a charge nurse. And so that type of function to understand what is it you're working on with this particular pod? How are we using the other pods in the area? When do we staff them? When do we scale them back down? And it was a great session on that particular day. I also, on that particular day, ended up spending a lot of time with our ER medical director because she was on that same shift. And so she happened to be with us for most of the day. Had a great experience, quite frankly, when we were working our way through and I was talking to our nurses that are responsible for offloading with EMS. And so these are trauma nurse leads that also had that function. And one of them had been working with the local Chatham County ambulance service. And in this moment, I was no longer Hugh Tappan division president. I was Hugh Tappan, Tanner Tappan's dad, because my son Tanner worked in Savannah running EMS for about a year and a half while he was post undergrad and trying to get ready for medical school. And so I was connecting with some of these EMS coordinators about my son. And so it really was a great moment of that being my primary role, because as we all have the different roles in our lives, right? Our roles as parents are incredibly important to us, and having our kids be recognized in different settings always gives every one of us joy, right? But I couldn't help but be super happy that that's how I was recognized in that moment.
Oh, I love that. So, a little bit more detail about the initiative itself. So, how are the clinicians selected or the units selected to be shadowed?
Yeah, so generally I'll decide I want to walk in a particular hospital and I'll call that executive and just say, here's what I'm thinking. Is there someplace you would recommend instead of that? And we just do a little back and forth on what are the goals and what are we trying to accomplish with this particular walk. At that point in time, was really interested in exactly what I kind of ran through. It was the offload times with EMS, and how were we focusing on that relationship with EMS to make sure that we were providing them everything that they needed for a great experience. And so that was my recommendation. Here's what I'm thinking. I'd like to be in the emergency room. The CEO agreed with me and said, here's the CNC that I'd recommend. And then we frankly triggered the next steps. And so for us, once we pick a location and we pick a day, generally then follows the person, make sure that they're on the schedule. And then we need to ask what their shoe size is. Because when I show up, I'm going to show up for a walk in your world, and I'm going to wear a particular shoe, and I'm going to give that same shoe to the person I'm following. And so we're going to give out orange and white and blue colored shoes as part of walking your
I love
world.
that.
And so it creates a nice visual, right? Where we can just have a fun moment to celebrate your walking around. And so I've been giving out shoes across a couple states, and that's been a lot of fun.
When you said that, I was thinking, well, that's an interesting
Yeah.
metaphor. And then it wasn't a metaphor at all.
Nope.
It's absolutely literal. What is your shoe size? I'm
Literally
bringing you
giving
shoes.
shoes.
Yeah, I love it. So when you go into these different hospitals and units, do you go in with kind of a set of expectations or a particular mindset coming in as the division president, or do you just kind of let it play out and kind of go with the flow?
Well, I try to do exactly that. And
Hmm.
frankly, remove any preconceived notions. I'll look over the current information for that particular unit as I'm going so that I've got some of the basics, right? What's their turnover look like across the past year? What's their patient experience look like for that particular unit? What was the physician engagement scores for that particular unit in the last year? And so it'll just give me a sense of the level of performance of a particular unit on several different measures. And so I'll try and take all that information in. And then walking in, I just try and put it all to the side and ask, okay, tell me about your unit. Tell me what you do every day. Tell me your why. Tell me the things that give you the greatest joy that you're able to do in any given day. And tell me the things that really frustrate you. Now, I don't unpack that all in the first 20 seconds, but
Right.
across those 4 hours, we can get into every one of those questions. And it's a lot of fun.
I love it. I love that it keeps coming back to fun.
Yeah,
I know. I love that.
I know I sounded a little bit like a one-trick pony there, but
No,
No.
no,
I'm sure
it's
that
really
comes
inspiring.
across too. Like, I'm sure they can feel that you're enjoying yourself as well, that you're not just there to monitor their activities. You're having fun and learning.
that's right.
So, one of the things we hear a lot is the sense of sort of mattering at work, right? Feeling that your contributions are recognized and understood. And so as you've done these as shadowing experiences with clinicians, anything stood out that sort of surprised you about kind of how they spend their days or things that they do?
No surprises. It's been a lot of reinforcement. It's been a lot of reinforcement of rounding throughout the years. There have been multiple times that I have said, wow, I thought we fixed that. I thought that was, that was a little different. So why isn't it different, right? You assume that based on, I don't know, all the different IT systems that we have today, that the ability to access information would be a little bit different. And it is, but if you're in the middle of your day and you're a CNC in the ER, just to stay with that idea, you've got, the normal flow of a day in an emergency room is there's kind of a buildup through the morning, right? And then there's kind of a mid morning rush. And that's when we need to have everything open and ready to go. You get into late afternoon, there's kind of this secondary rush. We tend to have a moment during the morning when we're able to pull a lot of patients that came in through the night up to the floors a little bit more easily. And you just think, okay, so I understand the normal kind of cadence of work in the emergency room. How have we been able to help over time as we've added in transporters or as we've thought about different functions and how do we do phlebotomy in the emergency room and who's responsible for that? You think or you hope that we've made the work a little bit more rational. How about that? We'll use that word. And that we're helping to even out the work through the course of the day. But the ER just is what it is. And people walk in when they walk in. And throughout my career, they feel like they're clustered. They don't come in one at a time across evenly spaced 24 hours. They
Unfortunately
cluster.
not.
And suddenly we get a rush and we get a rush and we get a rush. And that's one of the things that people in the ER, right? They love the adrenaline of, I just got 3 rooms. I got to move. And I need to keep with me, right? Let's go. And so having that reinforced that the work just happens when it happens, and there's only so much you can plan for, right? I tend to look at information that is amassed over a month or a quarter or a year, but that's not how staff experience it. They experience it minute to minute to minute, and so the data can say one thing, and the reality can feel different. And so it's important for me to kind of stay open and ready to hear what I need to hear because of realities like that. I hope that makes sense.
Yeah.
It does. And it just makes me think of, certainly data drives evidence informed decisions. But with you walking alongside these frontline clinicians, you're putting faces with data, right? You're hearing it from the horse's mouth, you're seeing it. And I love that perspective that you mentioned about, you know, depending on your role, you have to see through different lenses. And that clinician lens is that, what do I have to do next? What's my absolute next step? I can't think about what I'm doing in an hour or tomorrow. And to really understand how different those perspectives are is important in your decision making. We're also interested a little bit in kind of the patient perspective when you're in the units. So we know that professional fulfillment is tied to a healthy workforce as well as patient outcomes. So, how do patients respond when they see you or other hospital health system executives walking alongside these clinicians?
So, I'll back up. Quick story. When I was in my first role as the COO, all the way back, Houston Sports Medicine Hospital, I had a very old school chief executive officer at that point in time, a guy named Charlie Keaton. And Charlie was an absolute fantastic administrator. He was a white glove kind of administrator. He was going to grab a white glove when we rounded together, and he was going to test for high dust. Every patient room we ever walked into, he was reaching up to try and prove a point. And it only took one of those rounding experiences with Charlie to know, okay, here's what I need to be ready for. And here's how I need to be thinking about our environmental services functions in the hospital. And so when I'm rounding with my EVS leader, this is what I'm going to do to make sure that we're ready. Charlie told me about rounding. When you show up at the hospital, I don't care what day it is, I don't care what hour it is, you're going to wear a tie. You're going to wear a tie. By the way, always wear glasses. You look too young to do this job if you're not wearing a tie and glasses. And there was,
Interesting.
I'd wear contacts on the weekends. But I was on call one particular weekend, and I showed up because I'd been out with my very young kids at that point in time. And it must have been springtime. I'm in jeans and a shirt. And I get a call, and we've got a patient issue, and I need to get there. I need to help out. And so I think, all right, I'm wearing jeans, but I got to go in. I don't have time for change. And so I run into the hospital, and I meet with this visitor who's upset and had every right to be upset. And he said, look at you. You're not a hospital administrator. Get me the hospital administrator. The way that we look matters is the point. And so when I'm rounding today in a walk in your world, I'm wearing scrubs and I'm wearing tennis shoes. And so quite honestly, I don't look like an administrator. And
Okay.
so oftentimes we'll walk into a room, and I'll walk in with whatever nurse I'm shadowing, and the nurse will introduce herself and she'll introduce me. And this is what we're doing. And do you mind if he's in the room? And I'll introduce myself again. And they'll almost always say, that's fine, no problem. I have been excused from the room a couple of times, and that's okay, right? That's every patient's right. And I respect that. But inevitably, when we get to the end of that interaction, they'll say again, now, who are you?
Wait a minute.
And
Right.
why are you here? Are you learning to be a doctor? Are you a student? And so it's humanizing. How about that?
Yeah.
But patients and visitors, because let's always remember that our patients in almost every one of these settings are scared, and they're only able to hear so much. having been a patient, I understand this feeling in spades that there's only so much you can take in these moments. And so you need somebody with you that can hear the rest of the conversation because you're just wired for a couple of things. When I used to round, when I was in the hospital every day, I'd walk in with a coat and tie, and you don't look like a doctor. You don't look like a nurse. You look like you must be a hospital executive. Why, yes, I am. And so let me talk about what's going on. But I walk in scrubs and it is confusing and it's not normal and it's always well received. And so
That's great. That's
That's
great.
awesome. So we've kind of talked about, the fun and the tennis shoes, but how does this firsthand experience, this really kind of getting down and dirty and seeing those perspectives, how does that translate into real improvements in culture or even operations?
So when we do this, one of the things that we try to do from the division level is, I described calling and picking a hospital and then picking a unit. We'll try and do that as a swarm. And so the division officers will try, we're not always able to do it because of our calendars, but we'll try to do that together. And so when we do that together and we hit all the different units, we'll come back together with the executive team and we'll run through all the items that we identified, the things that we believe that the hospital has within their control to work on and change. And then obviously we'll try and take a few things away that is going to take a broader effort. And so, for instance, if there was a concern that was about the electronic health record, that's not something that the hospital team can generally drive. We need to pull that back into the division level, review what the implications of any type of change might be, and then evaluate how we would push through that change. And so if there's a large capital request, as a for instance, is this something that the hospital team can manage in this particular budget year? Is this something we need to think about differently from our level? And so that's the process is we all gather back. What did you learn? What do we want to recognize as as very positive parts of the experience? And what are those takeaways that we need to focus on to change?
I like that.
I like that team dynamic that you all go in together you don't have to necessarily go back and relay your experience. Everybody has been there and kind of had that firsthand. So a little bit different angle on Beth's question. How is it, and if so, how are you communicating what you're experiencing to your board? Or, and how is that influencing, board conversation, decisions, and priorities?
Yeah, so the board of each hospital is going to learn from that local team. I don't tend to go back and circle back to each one of the boards, but
Mhm.
then the local executive team in their next board meeting will highlight here was the experience, here's what we did with this, and here were our takeaways, positive and opportunities for improvement. And so those local boards get involved at that level,
Mhm.
hearing that information. We've got a couple of board members that actually like the idea so much, they now do their own version of a walk in your world. And so that's been a lot of fun to see our board members adopt the same attitude and the same process.
Yeah.
And yeah.
That's
Well,
really
and
cool. I love that they like it so much that they wanna do it too.
that actually kind of you kind of answered already. My next question was about, so how do we move past this walk being just like this one time thing, right? How can we take this sort of listening style and move it into our everyday leadership?
Well, I like the end of your question there. And how do we take it into our everyday listening? Right. And that is really
Mhm.
the point. How do we listen more effectively? And I think that some of the ways we talked about this earlier, trying to be informed and open to new information, right? Trying to make sure that you've done your homework walking onto a unit so that if you hear something that just doesn't really make sense, you're able to say, how should I think about what you just told me in light of this, whatever this happens to be, right? So a really easy example would be, we're always understaffed, right? Okay. Well, what's your point of reference to that? How do you decide that you're understaffed? Here's how I look at it. How do you think I should be looking at this? Just as an example.
Yeah.
But that type of listening and that type of probing, I think is critical for leaders at every level. I think it's critical for our managers and directors and our executives and for all of us in these regional roles and corporate roles. I think it's just critical that we stay open and recognize that the way that we look at data, right, across a month, across a quarter, across a year, is very different than what time is it right now? At this minute, on this
Exactly.
day, in
Yeah,
this hospital, in this particular unit, or around this particular supply issue. And so we've always got to be ready to hear and really listen to what's being shared, because often if it's an understaffing issue, and I'm thinking about staffing across 24 hours or across a month, well, maybe I need to start thinking differently about the balance in that schedule. And maybe we do have a day night disparity, or maybe we do have a weekday weekend disparity. And so we need to hear it so that we can start to press in and understand it better.
absolutely. So I have a feeling that this conversation is going to inspire some folks to want to do something very similar. At least we certainly hope it does. So, for other hospital leaders who want to start bridging that gap between the executive suite and the bedside, do you have any words of wisdom, maybe some non negotiables for successfully implementing something similar?
Well, so I believe hospital executives across the industry round regularly. I believe it's just kind of a core, it's part of what hospital administrators do. Now, there are, I'm sure, lots of different examples where there are gaps. And so for any hospital administrators that are not regularly rounding, my encouragement would be start, just walk out and start at the top of your organization and just work your way through the building and start to meet people and be connected. But I believe that the majority of our administrators already do that. So then the next step, and what I believe this program is really designed to accomplish, is that deeper shadowing experience. And that's something that I did it sporadically as a hospital administrator. I would do it generally in the OR, but I didn't do it at the bedside. I would do it with some physicians, but I didn't do it across every type of job class in the hospital. So my encouragement would be try to be intentional and get to as many of those as possible in a year, and just carve out 4 hours, because I believe it takes that long to really have a broad perspective of what happens in a shift. If you can give up time for an entire shift, that's fantastic. But generally people are so busy and there's so many being items for our attention that it's just hard to give up that much time. But if you can give up 4 hours to commit to a person on a unit, you will find great value in that time. You will absolutely find things to celebrate, and you will absolutely find opportunities for improvement for you to take away and have discussions with the rest of your administrative team and with other department leaders throughout your facility. And so for anyone not doing it, I'd absolutely recommend put it on the calendar and get it going.
Love it. So, Hugh, one of the things that we like to do with our guests, if you're okay with it, is to put some contact information in our session notes or our episode notes. So, if folks are interested, they know a good path to get to the resource. So, we'll grab that from you later of who you feel like would be best to do that, and if it's you directly, that's amazing. But we just really want to express sincere gratitude today for telling us why. We appreciate that you are quite literally walking the talk and willing to share your experiences with us and our listeners. I had a few key takeaways that I wanted to share, which are, I loved what you said about be informed and open to new information. Even if it's the first time you've heard it or it's the 50th time you've heard it, you're hearing it from the lens of the person and their lived experience. And so that's always valid. The human impact of listening and experiencing to understand is really vital. That connection and relationship building are critically important to culture. And of course, try to have fun doing it. And you have been a genuine example of how much joy you find in your work. And that can't help but be inspiring. So we encourage our listeners to consider innovative listening strategies like a walk in your world to strengthen connection and community and bridge that gap between senior leaders and frontline workers. So to our audience, thank you for listening. To learn more about the Y Initiative, which focuses on a fulfilling workplace experience, please visit scy.org. And if you enjoyed this episode, please leave a review, share the podcast with your friends and colleagues, and follow the show so you never miss an episode. Thank you all so much for listening. And Hugh, again, huge thanks to you for your time today.
Thank you very much.
Job.
I enjoyed it.